Dr. Carriere, how has Henry Schein Orthodontics helped you bring your vision of dentofacial correction to the orthodontic profession?
Henry Schein Orthodontics is a company that always has been very much interested into bringing the latest technology and the maximum advancements to the orthodontist. So we have a very symbiotic way of seeing how professions should go, or where the profession would be going in the future, and we have a fantastic communication on this regard. So Henry Schein Orthodontics has been really one of the powerful engines to promote this technology, one of the powerful engines to help me into help us, because it's a big family already today in our system. It's a big family, and help us into bringing this message around for benefiting the patients and as well benefiting the life of the orthodontist, simplifying them.
At what point did you see the need to invent, so to speak, a new paradigm of dentofacial correction using the motion appliances and SLX brackets?
You know, a motion appliance and SLX bracket are inventions that has been developed or created to simplify the procedure and try to place the orthodontic treatment in a way in which everything is predictable. The orthodontic approach today, the patients of today, they need to have a predictable approach. They need to have an accomplishment of promises in terms of quality of results and in terms of treatment timing. So motion appliance and SLX bracket is in this side. Now, what we have been doing with the motion appliance is to change the paradigm in terms of seeing which is the most important thing in the orthodontic treatment. Already, Dr. Edward Engel, when he developed the modern orthodontics, he classified orthodontics in 3 types of malocclusions: class 1 malocclusion, class 2 malocclusion, and class 3 malocclusion. This classification is a sagittal description of the problem of the patient. So Dr. Engel already was seeing that the major problem of the patients was the sagittal problem. So it's the most important element to solve to accomplish a nice and elegant treatment and to accomplish a simple and short and predictable approach. So motion appliance is treating always sagittal first. Is the tool to approach the case and to declassify the case. Imagine that we are treating a class 2, bringing the case into a class 1. Or if we treat a class 3, bringing the case into a class 1. So from the class 1, then solve the other problems, the peripheral problems of the case that are already without the major problem, which is the sagittal one.
What expertise did Henry Schein Orthodontics have available that allowed you to move forward from conception through design, manufacturing, and sales?
Henry Schein Orthodontics is a very professional team in many areas. So we have the technology today, we have the motion appliance, we have the SLX bracket, we have the wires, we have the system, because the system is a full system in which we start from scratch and we have all the protocol to arrive to the end of the treatment in the different malocclusions. And also we have Henry Schein at different levels. First level is the engineering in which they have a great engineering team. The engineering team of Henry Schein is, I could say, that is the most brilliant team I have ever met. And we have a beautiful communication and the capacity of developing, of accomplishing the highest level of accomplishments or technology or engineering reality. It's amazing. So we have very active and very positive and very fructuous meetings in which we develop and we move forward the wheel strongly. Then it comes the marketing team. The marketing team, it's amazing. They are so brilliant. They know how to approach and how to position the product, how to make the doctors know that they have this tool in their hands and that this tool is going to be helping them into the process of treating their patients, and also they know how to highlight the elements that are more interesting of these technologies. And the sales team is so fresh, you know. We have a sales force. The sales force of Henry Schein Orthodontics is outstanding. The amazing part of Henry Schein Orthodontics is that it's quite new in the world of orthodontics, but they have had the capacity of bringing the best of the industry into the group. So now we have a beautiful group that covers all the areas, and this beautiful group is working on constructing a beautiful orthodontic family. So now we are very happy to, like here in the Henry Schein Orthodontic Symposium, to welcome many orthodontics of all over the world, that we feel that we are all on the same page, on the page of simplification, on the page of quality, on the page of the face of the patient, on the page of the respect to the orthodontic treatment and to the respect to the orthodontic patients and to their lives and to their beauty. So we are on the same page, and we are a big family that we are looking forward moving on and enlarging this family and creating a beautiful and fresh air in the orthodontic field.
Cooperation is a big part of your appliance system for the first part of treatment. How do you overcome this with your patients, and how do you motivate others to gain big results as a function of your system?
Well, you know, motivation, cooperation and motivation is something that it's a conceptual aspect that we should brainstorm. Today, it's totally different, the patient, that it was in the past. In the past, the doctor was saying this is going to be the treatment, the patient was not asking, just following the orders, and if the cooperation was expected, well, if the patient was going to cooperate, was going to cooperate, and if not, was not going to cooperate. Today, our patients like to know everything about their treatment. So we cannot shut up and just start treating somebody without explaining anything, because we are not going to start this case. The case is going to start with another orthodontist that is going to explain very well the treatment, that is going to let them know which will be the process, and once the patient feels that the orthodontist is going to accomplish properly the treatment because he knows very well which is the process, which is the step-by-step, and which is the target and the finishing treatment timings and everything, then the patient gets enough confidence to start the treatment. So the patients of today, they need to know. We need, as orthodontists, to explain them properly what we need from them. And when we explain them, then we will have beautiful cooperation of the patient. What is not acceptable today is to do not interact with the patient, do not explain to the patient things, because then we cannot expect any cooperation. So cooperation and motivation in our system, in our office, is never an issue, but never means never, because we explain. We explain deeply and simply, but clearly, what we want, where we go, and what we are going to accomplish. And then we are all on the same boat and we go in the same direction.
Conventional orthodontic thought has doctors treating the transverse problem first. In your system and practice, you emphasize sagittal treatment first. Why?
You know, I was telling that, well, which is the major problem in orthodontics? Well, we classify orthodontics as class 1, class 2, and class 3 malocclusions. Dr. Engel was already classified orthodontics into class 1 malocclusion, class 2 malocclusion, and class 3 malocclusion. So this is describing a sagittal problem. It's not describing a transversal problem. It's not describing a vertical problem. It's describing a sagittal one. Why is describing a sagittal one, and why Dr. Engel was not choosing transversal elements to classify malocclusions, or why was not choosing vertical elements to classify? Why we classified majorly class 1, class 2, class 3? Well, because the sagittal problem is the major problem that we deal in orthodontics. So we never let for tomorrow what we can do today. So in our system, we are going to approach the sagittal dimension first. Sagittal first. Once we accomplish the correct positioning of the sagittal position at the beginning of the treatment, then the problems that are on top of this case will not be the big ones, will be the easy to accomplish ones. So then we focus on transversal, then we focus on the vertical dimension, then we focus on the different dimensions. But then we focus that once we are in class 1 occlusion. Once we have the perfect matching occlusion in class 1 of molars, premolars, and canines that we have accomplished normally in the first 3 months of treatment. So from now on, the case will be much easier. The case will be much more predictable. The case will be much more easy to solve. And we will completely lessen and diminish the complexity of the case, and we will end up beautifully, in a very clean way, without the issues of not of not looking for the major problem at the beginning of the treatment. So before, when we were working on the transversal first, we were delaying the solution of the biggest problem in orthodontics, that was the sagittal one. So we don't want to delay this problem. We want to address the problem at the beginning and remove it from our area of work, you know.